Hi there, this is Dr. Jack Belitz, and welcome to the Ask Dr. Jack Show. We're here to answer your questions, so let's get down to it. Today, the topic is kidneys. One of my patients came in this week and saw that the CDC, the Center for Disease Control, had released a very startling statistic which said that 1 in 7 Americans was suffering from chronic kidney disease. That blew me away. Absolutely blew me away. And so I did some research on it and found out that yes, that is exactly the case. In fact, according to this study, 96% of those with early kidney disease don't even know they have a problem. So it's not one of those things that is kind of giving you symptoms that'll show up. It's by the time you get a symptom, it could be almost irreversible. So the best way to deal with kidney disease is to make sure that you avoid kidney disease. Couple things you can do. First one is monitor your water intake. It's one of the biggest things that you can do. Do you know how much water you should be drinking? It's a pretty easy formula. You take your body weight, you divide it by 2, that's the number of ounces. So for instance, a person that weighs 120 pounds, 120 divided by 2 is 60. That person needs to drink about 60 ounces of water, or 6 10-ounce glasses of water a day. So do the math accordingly with your own weight and figure out what you'll be doing. Now, most of my patients will come up to me, hey, does that pop I have this morning count? Does that coffee I had this morning count? No, absolutely not. Fresh, clean, clear water is what counts. It's important. Now, a lot of people come up to me next and say, well, there's no way I could drink that much. Well, let me tell you why most people can't drink that much. It's because we have this thing in our body called a thirst mechanism. It's what drives us to drink. And it gets satiated, or in other words, it turns off when your body detects that you've drank enough. Well, the problem is that so many of the drinks we're drinking are so full of flavor and taste that it overstimulates these little receptors, and the brain thinks that you've actually drank more than you did. So all of these sugary and carbonated and whatever beverages, they throw that mechanism off. You start drinking more water, you'll actually want to drink more because your body won't realize how much you're drinking. It'll see what you're drinking. Craziness. Also, don't just go and get right up if you're drinking 60 ounces of water and you should be drinking 90 ounces of water. Don't just drink another 30 the next day and call it good. You got to work up to it. So figure out where you're at and where you need to be, divide that by 2 and go there for a week or 2. And then divide that maybe in half again, depending on how far away you are, and then get up there. Let your body learn how to absorb all that extra water. It's not going to know what to do with it. Couple other big things real quick when it comes to the kidneys. The first thing that we want to talk about is some of the things that really damage the kidney, and one of them is chronic high blood pressure. So you've really got to watch your blood pressure. So take it every once in a while. Make sure that you've got a good blood pressure reading. Now, the most important number when it comes to blood pressure is the low number. So, that's the one that you really want to monitor the most. That's the one that's going to give you the biggest warning signs that there's a problem. If that goes over 95, you need to be consulting somebody. That's just all there is to it. Then there are some drugs that can definitely affect how much how badly your kidneys are. The first one is the protein pump inhibitors. So if you have been diagnosed with acid reflux or heartburn, things like that, the drugs that the doctor wants to prescribe for you, those are called protein pump inhibitors. They are found to really damage the kidneys pretty badly. So let me tell you, there are some things that we can do to avoid having to get on those drugs in the first place. So if you're dealing with heartburn, if you're dealing with acid reflux, stop into the office, 402-333-4848. Let's see if we can solve that problem without having to resort to a drug. There are definitely things that can be done. Reestablishing nerve flow to the stomach so that the stomach doesn't overproduce acid. Sometimes the cause is a hiatal hernia. We can actually physically get that hiatal hernia reduced. So there are definitely things that we can do for that. So that's the first class of drugs. The second one that can damage the drugs is the statins. So those are the ones that are worried about the cholesterol level. British Medical Journal said people who take statin drugs are much more likely to be hospitalized for acute kidney injury. Holy crap, that's the British Medical Association telling you that. So let's see what we can do about avoiding that. Again, there are things that you can do to lower your cholesterol besides taking these drugs. Your diet plays huge in it. And I'm not talking about avoiding cholesterol-loaded foods like eggs and things like that, because that's been proven that doesn't work. Stop into the office and we will talk all about that. There are some great things that you can do to help your body have lower cholesterol numbers so that you won't need to worry about getting on some of those medications. And the last one is the NSAIDs, the Advil, the Aleve, and those type of drugs. People think, well, they're over the counter, so they can't be really bad for you, right? Wrong. Absolutely wrong. Over-the-counter medications can be incredibly bad for you if taken in the wrong amounts, overtaking them. So be careful of that. I mean, you've really got to be careful. So if you find yourself taking aspirin because of pain for a prolonged period of time, let's try to get to the bottom of the pain. Don't just take aspirin to cover it up. Let's figure out why you're needing to take it, and maybe we can get rid of that reason so you don't have to. Anyway, just to the basics of this, okay? When it comes to kidney disease, protect your kidney, because you won't probably know that you have a bad kidney until it's pretty much too late to do anything about it. You got 2 of them, but that's it, And then you have to worry about some really crappy lifestyle changes like dialysis and stuff. It's no fun. So let's do a good job of protecting that kidney. All right, this is Dr. Jack Belitz. I'm a chiropractor here in Omaha, Nebraska. Not here trying to give you medical advice. Absolutely not. I'm here to give you great information that you could easily get for yourself just by looking on the internet, but maybe just don't have time, and that's totally cool. That's what I'm here for. But, again, it's just information that you can use to make important and informed decisions that are best for you and your family. I hope you have a very happy, and healthy day. If you have questions that you would like us to review for you, ask Dr. Jack B, that's BEE @gmail.com, is a great email address to get it to us. Or go ahead and call up the office, 402-333-4848. You can also use that to make an appointment to talk about any of these things or other things. Or stop into the office and ask me in person. That's what I love the most. Have a great day. I'll see you on the next episode.